I'm at the National Consortium of Breast Centers Conference, the NCBC conference in Las Vegas. They have an annual conference filled with breast center administrators, RNs, doctors, etc. And I'm exhibiting here this year, and I've met some incredible people exhibiting, as well as other people that are attending the conference, and I wanted to introduce you to them. Enjoy.
I'm Off, the Spirited Sister #1 from Spirited Sisters Incorporated, home of the original Healing Threads. We design and manufacture what we call recovery wear. Other people have likened it to an alternative to a hospital gown, but we don't like that reference. We much prefer a recovery wear. You can buy this on the internet, or you can buy it, if you're a lucky person, your doctor will buy it for you and give it to you. It is a top that opens completely. If you have an incision across your chest, you wear this top, and there's no need to expose your entire body just to see a little piece of something. If you have a portacath, you just pull this down, or you pull the other side down, and your portacath is easily accessible. If you have something that really needs to be looked at, then you pull the whole thing down. On the back, it opens in the back, so if you need breath sounds, direct contact with the skin breath sounds, you just open this and there it is. One of the best features of this too is the interior pocket, which will accommodate a drainage bag, a monitor, or a pump. Much nicer than clipping it to your shirt. It's discreet, it goes away. You can wear this in the hospital, medical staff loves it. Wear it in the hospital, bring it home, wear it as you recover. It's healingthreads.com. It's all about dignity, modesty, and empowerment. Please visit us on our website, healingthreads.com. Thank you.
I'm Phyllis, and I founded Wear Ease to provide post-mastectomy and post-surgical products to women. And our goal is to provide comfort, function, and beauty. And so if you look at our post-surgical camisole, it has a little bit of lace in the front. And this is a post-surgical camisole that the woman would wear home from the hospital. And it also comes in 3 other colors: nude, pink, and black. And it comes with 2 breast forms and 2 drain tube pouches. You can find them on our website.
What's your URL?
www.wearease.com. So it's wear, W-E-A-R, E-A-S-E. So MammaPad actually is a foam cushion that is placed on the imaging receptor when you're getting your mammogram. And what it basically does is it creates a soft, warm surface between you and the mammography system. So when you're getting your mammogram, it creates, kind of a nice cushy surface for you as you're being compressed, and it actually helps to make the mammogram much more comfortable so that you can sort of get through the compression and what pain you might feel, helping you, want to come back for your mammogram every year.
Hi, I'm Teresa Yoder, and I'm a breast cancer survivor, and I started searching. I'm also a women's health nurse, started searching for resources for women I work with, and found Pink Link and love it. I correspond with women if they have questions. I try to help them, newly diagnosed, and it's just a really neat way to connect with others. And since I'm a women's health nurse, it's also a way for me to talk about my experience with women who don't know what I do professionally, and I can connect. It's just a really wonderful site.
Breast cancer risk assessment test for women ages 25 and older, and we're looking to identify a biomarker for risk. And how we do that is through this machine. It's the Halo. It's a 5-minute automated process. These cups fill up with water, and then they're placed on the breast. We push start, and in 5 minutes it works to elicit nipple aspirate fluid from the ducts, because that's where the most invasive breast cancer occurs. What we're looking for is what's called atypia from that fluid. Atypia confers a 4 to 5 times increased risk of developing breast cancer versus a patient who does not produce fluid. And so what we're trying to do is take the general population of women who may not know that they're at risk for breast cancer, extract them out of the general population, and put them into a risk assessment program to have them followed and monitored more closely to make sure that their cancer never progresses, or we can intervene earlier.
Website?
The website is www.neomatrix.com for more information.
I have designed a medical surgical doll that shows the 4 surgical procedures that women are given the choice of once diagnosed with breast cancer. Her name's Vicki Victorious. She is designed to show 4 surgical procedures that are offered. We have the free tram, the pedicle tram, the implant, as well as the latissimus dorsi. She is designed to go to the doctor's office so that the doctors can go ahead and show the patients the different options that they have so that they can choose which surgery they like the most. We also have a video that goes right along with her that doctors' offices commonly send home with the newly diagnosed breast cancer women, and the family members can go ahead and watch the video so that when the family members get together to watch it, they can write down all their questions that they have for the doctor, and then the doctor can answer all those questions. It helps them decide which surgery that they want and which one is best fit for them, and it helps the families get ready for the surgery as well so that they can help their family member get through it in a better way.
I'm BJ Hardman. I'm CEO of Sonaris Technologies. Sonaris Technologies makes a cryoablation product which freezes breast tumors in place. We've been doing benign fibroadenomas for the last 9 years, and we're now in a phase 2 cancer trial for cryoablating cancer tumors using a minimally invasive process which has a 1/4-inch skin nick as the only visible scar after the cryoablation. So I just started an ice ball on the probe. This looks very scary. It's not really. This is placed into the breast through, again, 1/8 of an inch to 1/4 of an inch skin nick. The cryoablation cryoablates the tumor and literally freezes the tumor to death, and you have a 1/4 of an inch or less skin nick, which is all you have, and your tumor is dead. We are Sonaris Technologies, www.sonaris.com, SANARUS.